My name is Deane Smith. I'm an adult cardiac surgeon at Northwell Health, and I'm the surgical director for the heart transplant and MCS program at the Transplant Institute. I'm a heart surgeon first, prefer to be in the operating room doing heart surgery, but in my role as the director for the transplant program, I'm also evaluating patients for heart transplant and their care afterwards. My interest in heart surgery came really as a college student. I worked in a lab. And part of my job was to get to observe heart surgery. I knew I wanted to do that. I only really know about 3 things. I know about heart surgery, sports, and hip-hop music. There are lots of great transplant programs in New York State and in the country. But one of the things that we really try to do is adopt the patient into our own family, in the sense that we know that transplant patients become lifelong patients. The Transplant Institute at Northwell provides a real opportunity for us to take care of complicated patients. And that vision of creating an environment where transplant patients are the focus is something that was really appealing. The Petrocelli Surgical Pavilion is a world-class facility. And part of what makes the operating rooms unique is the size of the space. Many of these operations are complicated. Sometimes it's multi-organ transplant. So to have a room that can accommodate those complexities is really helpful. And we look forward to bringing that to the patients at Northwell Health. One of the things that's unique about transplant is it requires a real collaborative effort, and not just for physicians, not just cardiologists and surgeons, but we also need the assistance of infectious disease doctors. Sometimes it's pulmonologists. It's really an impressive group of people that come together to create this environment where patients can receive great care. The real joy for me is helping a patient who's sick. We come across patients all the time who really only have one pathway to get home, and that's the most satisfying part of my job, when we get that patient home to their family.